Hi everyone, good afternoon guys. I hope I'm audible and visible to all of you. So welcome to this afternoon session, and like I had told all of you yesterday also, we are continuing the same pattern, and that happens to be two lessons that we have back to back. So first, from 2 o'clock right now up till approximately 2:30, we'll be having a session on this channel where we'll be discussing the different red blood cell shapes and morphologies. Thereafter, we'll be meeting once again at 2:40 p.m., which is a thing that we started on the Unacademy app, which is known as the open house session. Now, many of you were a part of this open house session. It's like an audio only session, no video, no PDFs, no screen sharing. It's an audio alone session, more like a podcast, but also a method of learning, which sometimes is very good for building up your memory. So yesterday, if you all remember, we had discussed something to do with the CD markers. Today we'll be having CD markers part 2, so that all the markers of whatever we have to know in pathology are completed for us. So these are the two lessons that you have to look out for. And additionally, all of you know that today morning we could not have a kickstart morning session. So like a bonus session, I've put up one session again at 9 p.m. tonight. This 9 p.m. session is going to be on the Unacademy app. It is free for everyone to attend, and this is going to be based on the image-based questions. So this is for all students, NEET, FMG, INI, CET. Some quick 40-45 minute session, some quick image-based questions we'll be discussing, and that will be on the Unacademy app tonight at 9 o'clock. Okay, so Dr. Sayak, skin tumors and salivary gland tumors are planned in the coming month in the Kickstart morning session. So that is where you could attend these topics, right? Okay, so I guess we are done with all the orientation of the classes of the day. Let's start with the session. Yesterday, if you all remember, we did all the inclusions, all these bodies written over here. We did all of that. And what are we going to do today? All the different shapes that are written, first we'll figure out those. So before I begin, the very first one, which is the most important, and I'll enlarge it even further if you guys want. Whenever you get a PS means whenever you get a peripheral smear, the first thing that you have to search, you want to comment on the red blood cells, you want to comment on their size, their shape. So the first thing that you try to pick out is a lymphocyte. That's the trick of solving a peripheral smear. So the first thing I pick up is a lymphocyte. And which part of a lymphocyte? The blue color dot. I pick up the nucleus of a lymphocyte because I know that a nucleus of a lymphocyte is approximately 7 microns, means it is similar to the size of a red blood cell. Even a red blood cell is 7.2 microns, right? So 7 microns is what I know a lymphocyte is, and I have to compare the red blood cells with the size of a lymphocyte. So for example, if this is the size of the lymphocyte that we have, and I ask you that what do you think is the size of this red blood cell, or what is the size of this red blood cell, so you can very clearly see that these red blood cells are all smaller. So can I label them as microcytic cells? That is a very important feature, that the first shape variation that you can get, or first size variation I would say, size being small, and that is going to be microcytic. So how did I get to know it's a smaller size? I compared it with the size of a lymphocyte nucleus. Thereafter, the next thing that you have to comment on is the color. So if I draw a normal red blood cell, this is how I'll draw a normal red blood cell, means how much of the center will I leave as empty. So remember, 1/3 pallor is a normal thing. 1/3 pallor is considered as a normal finding, and if I say that no, the red blood cell is looking like this, means very very white, it's showing you more than 1/3 pallor, you'll say, ma'am, this means the hemoglobin is less. This means the cell is hypochromic, less of color. Hypochromia is what I'm seeing. So have a look at these guys. Have a look at, for example, this red blood cell, or look at this red blood cell, or any one that you pick up. You don't see only central 1/3. You see most of them are empty. So I can clearly mention that they are hypochromic. So what kind of a peripheral smear does this become? You'll say that, okay, this happens to be a microcytic hypochromic peripheral smear. Anything else that you guys see over here? Any shape variation that you guys are able to appreciate? I'll highlight it. What is this cell that I've highlighted over here? Because this gives you a very good hint and a very famous question. So it's known as a pencil cell. This cell is referred to as the first shape variation that I'm telling you. This is a pencil cell. So overall, now I know it's a microcytic hypochromic blood picture with the presence of pencil cells. And when I get this kind of a peripheral smear, I'm very commonly doubting that this is a case of iron deficiency anemia. So I think the first 2-3 things are very clear in front of me. If I have to categorize this chart, you know that fine, if there is a normal size. If the size of the red blood cell is small, it becomes microcytic. If the size of the red blood cell would have been more, it would have been macrocytic. Further, anything less in color means how much of pallor is more? You'll say 1/3 pallor se zyada, more than 1/3 pallor. So you can see how the center is becoming empty, empty, empty. So all of these come under hypochromia cells. So first, size and hypochromia I've understood. Now let's go on to the next slide. So what do you see over here? First, let me ask you, what is the shape of the cells that I have encircled? The ones that I'm encircling, any comment on those? You'll say, ma'am, they are completely round. They are completely spherical and they don't have any pallor. They are full of the hemoglobin. Can you see there's no pallor that I'm seeing? They are full of hemoglobin. So firstly, because they are completely round, we call them correct. Everyone's right. These cells are referred to as the spherocytes. These cells are spherocytes. So first thing that the examiner will ask you is that how do you define spherocytes? Are they, I've understood they are round, they are spherical, but are they smaller than the red blood cells or are they bigger than the red blood cells, normal red blood cells? So I like to add a word over here. I like to call them microspherocytes, means that their size is lesser than a regular red blood cell. They are smaller in size. And what are the three conditions? The three most important conditions in which I can see spherocytes. What is the most common cause of spherocytosis? And that is autoimmune hemolytic anemia. That's the most common cause. Other than autoimmune hemolytic anemia, the very famous hereditary spherocytosis, I'm sure everyone thought of as the first thing. And thirdly, even G6PD deficiency can show us spherocytes. So please remember, as I see most of you are answering, spherocytes are seen in three main conditions, out of which the most common cause is autoimmune hemolytic anemia, then hereditary spherocytosis and G6PD deficiency. But other than that, ये spherocytes तो समझ आ गया. But other than this spherocyte part of it, did you also see some other population? If I open this for the house today, I ask all of you, any other cell population that you see out here, anyone who wants to give me an answer other than the spherical population? Yes, a quick 30 seconds I give to everyone to think over it. Any other cell that you wish to point out? And if you see, teardrop, no, teardrop isme nahi hai. Teardrop I'll be showing you in a while, then you'll know the difference. Anything else? See the size, maybe all the cells are very small, but then can you see some cell which is very, very big? Can you pick up these two jumbo cells out here? Yes, and I want you to analyze two things. एक तो ये जो दो jumbo cells हैं, these two jumbo cells that I have highlighted out here, first thing you'll say that ma'am, their size is more. I agree with you. That's why we are calling them jumbo cells. And also look at their color. Does everyone agree that these two jumbo cells have a little bit of a bluish color than the other red blood cells? Other red blood cells are reddish. But these cells are not only bigger, but they are giving me a little bit of a bluish tinge. So how have I learned these cells? Please remember, when I'm seeing cells which are big and blue, the red blood cells which are big and blue are known as the reticulocytes. Yes, what is the other name for a reticulocyte? Reticulocyte is also known as a polychromatophil. The two names of a reticulocyte are firstly reticulocyte and second it is a polychromatophil. And how will I identify it? Apart from the regular cells, it will be big and it's going to be blue. Big and blue cells are polychromatophils. I hope that is okay with everyone. So this smear taught me two things. First is the spherocytes, and the second thing that it taught me was the big and blue cells, that is the reticulocyte. Okay, having said that, now let's move on to the third image. Is it crystal violet stain? No, abhi tak whatever I have taught you is a normal Romanovsky stain, but if you ask theory questions from that point of view, then reticulocyte is not stained with crystal violet. Reticulocyte is stained with new methylene blue. Reticulocyte is stained with new methylene blue, but that's not the question here. Over here I'm showing you all normal Romanovsky stained slides. Okay, meanwhile I had started off with the third one, and yes, all of you are right. I think this is the most classical one, the three arrows, because the cell looks as if it's bitten off. So firstly, all of you are right, these are definitely bite cells, but bite cells have another name to them, and bite cells are also known as degmacytes. Bite cells also known as degmacyte. And which disease do we see this in? We see this in G6PD deficiency. G6PD deficiency, yesterday I had taught you some bodies also in G6PD deficiency, which all of you were very confident about yesterday. So now we've completed everything. When I talk about G6PD deficiency, we see two things. Number one happens to be the bodies that we saw, that was the Heinz bodies. I hope everyone remembers, we've studied it yesterday. And number two, the cells that we see are known as the bite cells or the degmacytes. So the first, there are a lot of D's over here that I'm going to teach you today. This is the first D. The D for degmacyte is a bite cell, because now comes the second D. What are all these cells that you're seeing over here? What shape is this? What RBC shape? Very classical. Once you see this shape, I think we are never going to forget it. It looks like a sickle, because these cells are said to be the sickle cells. And no one's going to ask you the name of this, because they know it's very evident it's a sickle cell, but they'll ask you the other name for it. And the other name for a sickle cell is a drepanocyte. It's a drepanocyte, and no points for guessing. Where will you see a sickle cell? You will see it in a patient of sickle cell anemia. So yes, that's the next D that you learn. The drepanocyte is the sickle cell. There's a third D also that comes in red blood cells, and this is the third D. Abhi sometime back someone told me, ma'am, teardrop cell hota hai. See, a teardrop cell should look like a teardrop, like a drop of water, like a drop of tear, right? And this is how a teardrop cell will actually look like. So see, can you see this cell over here? It's looking like a teardrop. This cell over here, this cell over here. So there'll be one pointed extension coming out of it. That is what you will call as, a drop of water or a drop of tear. That is a teardrop, and that's the third D. That is known as dacrocyte. That is known as dacrocyte. So three D's that I've taught you: degmacyte, drepanocyte, dacrocyte. First tell me, this dacrocyte or teardrop cell, which condition is it seen in? Everyone's right. This is seen in myelofibrosis, a very important question that you get in the exam. I'll tell you the concept behind it. When they say myelofibrosis, I'll draw this bone marrow out here. When they say myelofibrosis, they mean in the marrow, bone marrow, there is fibrosis. So in the bone marrow, there is a lot of fibrosis that is there. Which means that when the red blood cells are trying to come out, they've got a proper meshwork of fiber. They have to force and find their way through. They have these fibers stopping it. So in that attempt of struggling and coming out of the marrow, their shape changes. They become these teardrop in shape. So the reason for teardrop is the resistance that they face. The fibrotic tissue creates resistance and their shape changes. So finally, when I try to put all the three D's together, these are the three D's that you had to know, which they will ask you, and you don't have to get confused. The first D that you see over here, I know it's a bite cell, but the first D that you should know, bite cell ka dusra naam kya hai? Degmacyte. How will you learn it? So bite should remind you of dog bite. So you can even learn it as dogmacyte. Dogmacyte is which cell? Dogmacyte is the bite cell. So degmacyte, dog, bite. Coming to this one, this is the dacrocyte. Dacrocyte basically means teardrop cell. I think everyone knows that in ophthal, when we use the word dacro, we use it for the lacrimal gland, like dacroadenitis. So dacro word is for lacrimal gland, right? Lacrimal gland which produces tears. So dacrocyte is the word that I will be using for the teardrop cell. And the third D that we have, the one that you don't need a mnemonic for now, that is the drepanocyte. And drepanocyte is nothing but a sickle cell. Are we all clear with this? The three Ds: degma, dogma, bite cell; dacro, tears, so teardrop cell; and drepanocyte, sickle cell. So all of this is done. Let's move on to the three Ds, which are most confusing. I hope those are over. Now let's move on to the next one. Here all the weird RBCs are encircled, and you'll say, ma'am, I can't come to a conclusion. All of them are of a different shape. This one is looking a little pointed. This one is looking like a triangle. This one is looking like a helmet. So all weird kind of shapes are put up over here. So can I say these are fragmented red blood cells? These are fragmented red blood cells, means they are broken. They are fragmented into pieces. So first thing is, it can fragment and it can change into any shape. It can look irregular like this also. It can look like a triangle also. It may look like this. It may look like a helmet. So if they are talking about helmet cells, triangular cells, they're talking about the same thing. So all these they have grouped under one term called fragmented red blood cells, which are also known as schistocytes. So schistocytes is the name given to fragmented red blood cells. So next question that they'll ask you is, where do you see schistocytes? You see it in microangiopathic hemolytic anemia. Where do we see schistocytes? Microangiopathic hemolytic anemia. That's a very famous question. If we have FMG students attending this, this is a question that has come in your previous year also, that fragmented red blood cells are a part of which anemia? They are a part of MIHA, microangiopathic hemolytic anemia, which many of you are calling as HUS, TTP. वो क्या है? They are types of MIHA only, na? Hemolytic uremic syndrome, TTP, DIC, all of them come under the microangiopathic hemolytic anemias only. So they are just examples of the same thing. Perfect. तो ये schistocytes हो गया. आगे बढ़ते हैं. What is this? This is a slide where I want all of you to give me observations, because it doesn't have one cell. It has lots of cells, lots of varied type of cells it has. So I want all of you to give me an observation on what all are you seeing. Yes. So, okay, first answer I've got target cells. I see three cells, guys. I'm expecting three answers. One is target cell. I agree. Two more answers left. Two more. Okay, echinocytes I've got. Second answer मिल गया. Third answer. Target cells done, echinocytes done. Echinocytes का एक cousin brother होता है, very similar sounding. Echinocyte and acanthocyte. Okay, so three answers I've got. Now let's start labeling what all I'm seeing over here. सबसे पहले I'll start with the first answer that you guys gave me. All these cells which look like a target. All of these, because exactly like a target. Some of the hemoglobin is here. Some of the hemoglobin is at the center. So these are known as target cells, but everything has a different name, right? Target cells are also known as podocytes. Target cells are also known as podocytes. So first you'll ask me, ma'am, target word I've understood, because it's looking like that dartboard, the target that we have. Why do you call it podocyte? Because the meaning of the word kodo का मतलब होता है bell. Kodo means bell, and when they saw these target cells on electron microscopy, they realized they look like a bell shape. These on electron microscopy have a bell shape, and bell का दूसरा नाम है kodo. So that is why target cells are also known as kodocytes. Okay, having said that, now you'll ask me, where all can we see target cells? Is it specific for anything? Not at all. Target cells can be seen in many conditions, but where do you get maximum questions? T for T. Target cells are seen in hemoglobin disorders like thalassemia, like hemoglobin C disease, like hemoglobin E disease, and even in cases of iron deficiency anemia. But again, reminding you, सबसे important जो question है, that is target cells are seen in thalassemia, and thalassemia means hemoglobin disorder. So along with that, some other hemoglobin disorders like hemoglobin C, hemoglobin E, they can also show you target cells, also known as Podocytes. That was the first finding. Target cell हो गया. Second finding देखते हैं. Second finding all of you told me was echinocyte. So now I'm putting up the second finding in this particular picture. Target cell तो done. Now I see the second finding, and that is this. So let me draw out what is this cell showing you. I see a cell which is blurred out like this. It is blurred out like that. The membrane is not defined like this. It's blurred out. It's irregular and blurred out. तो ये जो blurred out membrane है, I call that a Burr cell. The blurred out membrane is basically a Burr cell, and please remember the other name for a Burr cell is an echinocyte. The other name for a Burr cell is an echinocyte. So, many of you were also calling it something called spur cells and acanthocyte. So there's too much of confusion. Which is a Burr cell, which is an echinocyte, which is a spur cell, which is an acanthocyte. बहुत सारे terms हैं. So remember, these three alphabets will have everything to do with it. The way you write a B, the way you write, or probably the way you write an E for an echinocyte is the same way you write a B. So if you get confused, कि echinocyte क्या था? Was it a Burr cell or was it a spur cell? So remember, the way I wrote an E is the same way I wrote a B. So echinocyte and Burr cell happen to be the same thing. अगला देखते हैं. Where do I see these? I see this in three conditions. Listen very carefully. So first and foremost, these cells are seen in burn patients. Number one. Second, these cells are seen in patients with renal failure. That is, patients who have uremia. And number three, these are seen with prolonged EDTA changes. Means if the blood is kept in EDTA for a very, very long time, this kind of cell can come up. So I think many of you did know this answer, which is very good. That is, how do I learn this? Ke Burr cells. So B say I will think of burns. U will stand for uremia, and E of echinocyte will remind me of EDTA changes. Is the second cell also of this smear okay? Because now I come to the third and the last cell of this smear that you had to know, which looks as if it has spikes. Which looks as if it has spikes on it. So spike matlab, if I want to call it a spiky cell, S for S, I also call it a spur cell. Spiky cell or spur cell or acanthocyte is what we need to know over here. Spiky cell or spur cell or acanthocyte, they all mean the same. The meaning of spike, spur and acantho. What do all of them mean? All of them mean that there are spikes on the surface. And where are you going to see this? Please remember A for A. Acanthocyte is seen in A beta lipoproteinemia. It is seen in A beta lipoproteinemia. So finally, I think now you will not get confused that which is the acantho and spur and which is the echino and burr. The combinations are clear because somewhere the way you write E is the way you write B. So that is echinocyte and burr cell, and the other one is spiky spurry, that is the acanthocyte. So if I again show you the diagram, now all of you can identify the first cell that I showed you over here was a target cell. The second cell, which was blurry all around, the blurry cell was the Burr cell, and the third cell that I showed you over here was the spiky one, that was the spur cell. So I hope all three over here are also okay with everyone. Now let's move on to the last 2-3 I think that we have. Can you identify these two? See, the difference between these two is the most important. See what has happened here versus what has happened here. So firstly, let's see what has happened in the first one. I see that all the red blood cells are stacked. They've given you a picture for reference also. All the red blood cells are showing you like a stack of coins. And this stack of coins is very famously, yes, known as the perfect. Many of you have given me a right answer, and this is known as the Roulette Formation. Very famous question of pathology. And can you tell me which disease? Roulette formation, the stacking of coins, is seen in a plasma cell tumor, that is multiple myeloma. Multiple myeloma shows us the presence of Roulette formation. It's a 5-star question that you get in hematology. Roulette formation, I hope everyone is able. There is a very long stack of coins, but if you look carefully, there's a shorter stack of coins here, and there's an even shorter stack of coins here. So it necessarily doesn't have to be a very long stack of coins. Even short stacks of coins are being formed over here. That is all known as Roulette formation, and you see that in a case of multiple myeloma. Compare it with the other picture. You will say over here also the RBCs are coming together, but are they coming together like a stack of coins, or are they coming together like a clump? So please remember, clump or agglutination is what is happening over here. So the difference between the two is very important to know. I've put it side by side. I hope you are able to identify the difference. If they come together like a stack of coins, you'll call it roulette. If they come together like this clump, you call it agglutination. And can you now tell me which disease is going to show you this kind of an agglutination? The name of the disease has the word agglutination in it. That is what is special about the disease. It is CAD, that is cold agglutinin disease. Cold agglutinin disease is what you need to know out here. So it has the word, right? The name in it. Okay, it's a disease. I know that. Secondly, it's going to show me agglutination that I can see over here. And cold. Cold means that this condition will be seen at low temperatures. What is the temperature? Cold at 4 degrees Celsius is where we see this. And I'll ask you one small little theory question, that which is the antibody which works at this temperature, or which is the antibody which is responsible for this cold temperature or cold agglutinin disease? Very good. And that is going to be IgM. So I've got two questions which I'm coming up to this. So if I ask you that why did the RBCs make a clump, why did they agglutinate, you'll say, ma'am, this is a disease which happens in cold temperatures at 4 degrees, and the antibody which is responsible for this is IgM. So you've got your answer for the agglutination, the reason for that. Some of you want to know what is the reason of this stack of coins. Why in multiple myeloma have you got a stack of coins? I'll take exactly 30 seconds to explain that. Not a very tough concept. Let us draw normal red blood cells. These are the normal red blood cells that we have. And what kind of a charge do normal red blood cells have? All the normal red blood cells have a negative charge. And we know ये जो negative charge होता है, this negative charge is known as zeta potential. So can I say all the red blood cells which have this negative charge have basically something called zeta potential? That is normal, and my basic understanding from school days tells me that all same charges will repel. Since all of them are negative, they are going to repel from each other, they stay away from each other. But now imagine what happens in a case of multiple myeloma. Do we agree multiple myeloma means lots and lots of antibodies that will be circulating in the blood? So can I say all the red blood cells now will have a coating of an antibody around them? They will have lots of coating of antibody around them. So somewhere is their negative charge hidden. Because all these antibodies are coating them, can I say there is a loss of that negative charge or a loss of zeta potential that is going to occur? So now they are no longer showing that negative charge. वो negative जो था, that has been masked, that has been covered. So do you think now they are going to stay away from each other? Or are they now, because of the zeta potential being lost, they'll end up coming close to each other, and if they end up coming close to each other, they'll make a stack of coins. So has everyone understood that the reason for the Roulette formation is that in multiple myeloma, there are so many antibodies which results in a loss of the zeta potential, and that is the reason that the stack of coins is formed. So whosoever asked me, I'm sorry I couldn't see your name, but I hope your doubt is solved, right? Okay, coming to the last one that we have. These are very two rare ones, but we should know rare things also just in case they come in the exam. What are these red blood cells? This is an inherited disorder, autosomal dominant disorder है. क्या दिख रहा है यहाँ पे? You'll say, ma'am, over here, if I look at the red blood cell, they've got a slit in the center. They've got a line in the center as I see it. Again, like a stomata, like an opening, they've got a line in the center. So remember in school days, we used to read something like this in plants, like plants have stomata. So same way, these red blood cells also have a stoma or a stomata or a mouth in them, and these are known as stomatocytes. These are known as stomatocytes. If you ask me, ma'am, why does this happen? I'll say it's an autosomal dominant condition. It's a genetic disorder. So a very rare question to come, but I'm just showing you the rare ones also. One last that we have is this, and who's going to answer this for me? The one that has been shown with an arrow. If you want, I can draw it also. It's looking more like a mushroom. More like a mushroom. Okay, Dr. Abhinandini, I'll come to your doubt also. After this, what is this mushroom-shaped cell known as? This is also known as a pincer cell. Now that's something that could come as a future potential question. Yes, very good. This is a pincer cell. This is like you are seeing, it's in the shape of a mushroom. So you'll obviously ask me which disease are you going to see this in. So remember, in the membrane of the red blood cell, do we all know there is a protein called band 3? So please remember, if there is a band 3 defect, that is when I see a mushroom or a pincer cell. That could be one of the future potential questions. So have a look at this, mushroom shaped pincer cell band 3 defect. Okay, Dr. Abhinandini had a question, why doesn't the stomatocyte look like the HBC disease? HBC mein hemoglobin was what was shaded na. Here the center part is white, that is the pallor wala part. In HBC, you are saying yourself hemoglobin C, so that part had to be colored because that was hemoglobin. Here this part is totally white because it's the stomata, it's the pallor that is there. So they will look definitely different. Okay, and yes, with that we also wrap up all these shapes that we had to do. So I think all of you can see all of them now. See, have you done target cells? Quickly tell me one name for it. Target cell ka dusra naam kya hai? Target cell also looks like a codocyte, right? So target cell was codocyte. Then you had spherocyte, which was totally round, spherocyte. Then you had something with a stomata, so that is a stomatocyte. Then you had the sickle type, so that is sickle cell. Other name for sickle cell was drepanocyte. Then look at these. You have these blurry cells. The Burr cells, B and E were looking the same, so that was echinocyte. Then you had the spiky cells. Those were the acanthocytes. Then you had all broken cells, which were the schistocytes. And if they are broken in the form of a helmet, then you call it a helmet cell. Lastly, when there is a teardrop cell, tear sounds like dacro, so that is going to be a dacrocyte. Apart from that, did you also know when the clump is formed, that is an agglutination, and when a stack of coins is formed, that is going to be Roulette formation. Lastly, you also studied which was the cell which was big and blue. That is also what I taught you. The cell which was big and blue was a reticulocyte. So I think the entire table for all of you, yesterday we did inclusions, today we've done the shapes, morphology. So all in all, the entire RBC morphology is over. I'll be sharing the PDF of both these sessions today on the Telegram group. But before that, we'll be meeting shortly in 5 minutes on the Unacademy app, and we are going to take up the open house session and finish off our CD markers that we had to do. Yesterday we did half of that PDF. Today we are going to do the rest of it, and CD markers will be done. And just as an update for those who joined in late, there's another session at 9 o'clock today, which is an image based session, a 40-minute session at the max. And yes, that will deal with IBQs as a mixed bag. Okay, Dr. Ipsita, like I said, stomatocytosis है ही एक genetic disorder. So if you ask me where do we see a stomatocyte, we see it in stomatocytosis, and that is an autosomal dominant disorder. Okay, so yes, and Dr. Soham, definitely the 2.0 version is different because it's got more questions, it's got some lengthier questions, updated information, things that we've learned from the last year exams. So definitely it's added on and an improved version of the previous one. Okay, so thank you so much guys for joining in, and I think in another 5 minutes let's catch up again, open house on the Unacademy app. Let's quickly take 15-20 minutes of CD markers and get rid of that topic also. Thank you so much. Have a great day. See you in exactly